Welcome back to Murder of Facts.
Dr. Gary Grohmann is former Director of Immunobiology and the World Health Organization Essential Regulatory Laboratory at the Therapeutic Goods Administration. He currently works as an independent consultant, primarily with WHO, on influenza-related projects in the Global Influenza Program and the Essential Medicines Program. Dr. Grohmann has served on several WHO steering committees. His primary interests are vaccines, vaccine regulation, medical and veterinary virology, and infectious diseases resulting from contaminated water, as well as other environmental sources. Dr. Grohmann, thanks for joining us. Mpox, formerly known as monkeypox, is new to most of us. If you could explain to us where monkeypox has come from and where we're up to right now.
Okay, the history of monkeypox, it really started in 1970 when it was discovered, and it was affecting humans for the first time, but it was originally an infection of monkeys and apes, and that was well known. But the first human case was reported in 1970 in the Democratic Republic of Congo. And the virus now is endemic in Africa, in Cameroon and Central African Republic, the DRC, Ivory Coast, Liberia, Nigeria, Sierra Leone, Sudan, and a few other places. So now it's a very common infection in the community in those places. And then since 1970, surveillance started to begin in humans, and outbreaks were monitored in Africa. And it showed that monkeypox occurred mainly in children, in fact, to start with, under 10 years. And that's probably because of their association with wildlife. And then there were an increasing number of cases over time as population became more susceptible to monkeypox, mainly because of the termination of the smallpox vaccine campaign. So as it happened, smallpox gave protection to monkeypox as well, not 100%, but a substantial amount.
And in 2022, WHO declared it a public health emergency.
Yes. For the second time, in fact, in 3 years, the World Health Organization declared it as a global emergency, which is its highest level of alert. And what it does is demand that there's continued monitoring, surveillance, and response to monitor transmissions, but also to ameliorate any further transmission. And we found in 2022 and even up to now that Mpox, we call it now, spread quickly in Central and Western Africa. And as I said before, the virus is endemic in quite a lot of countries in Africa. But a new and more dangerous strain emerged, and it was detected in Sweden and Thailand. There are two clades, clade 1 and 2. The clade 2 strains are less virulent and have been predominating around the world. But there's a clade 1b strain that has caused this second declaration of the emergency. It led to over 100,000 cases from this strain and 234 deaths in 123 countries. So this global outbreak of Mpox, which is generally caused by the less virulent clade 2 strain, has now basically gone global. And I think in 2024, something like 28% of the African region, 89% of the European region, and 68% of cases were in the Western Pacific region. So you can see that it's spread very widely in the community, causing disease. Not the case in Australia. We haven't seen the clade 1b virus, but we have seen the less virulent clade 2 virus. So since August 24, there have been over 600 cases in Australia. And in Queensland recently, over the last year, there were 51 confirmed cases alone that were notified in 2024 of the clade 2 group. There have been no deaths reported in Australia, though, and that's been good news.
Very good news. Tell us about the symptoms of Mpox.
So the symptoms are very similar to smallpox, actually, but much less severe. But they commonly include a fever, a characteristic rash, and swollen lymph glands. And that's how it can be diagnosed, because smallpox doesn't exist anymore. So this febrile stage lasts for up to 3 days. And then you get further symptoms after that initial infection. You get headache, back pain, myalgia, and lethargy. So after this initial febrile viremic phase, where virus is actually in the blood, the virus can then spread to the nostrils and other organs like the spleen and the liver. And that results in another viremia or virus in the blood, and that enables the virus to spread further throughout the body into the lungs and kidneys and the intestines. And then you get an eruption of the skin with these characteristic lesions, and they develop into a kind of a papule and then into a vesicle. And that vesicle will then shed fluid. And then that's followed by scabbing, which takes somewhere between 2 and 4 weeks, depending on the person. The incubation period of passing it from one person to another is at least 5 days, but there have been records of up to 21 days. I think on average it's 5 to 7 days. It can be unusually short sometimes, particularly if there's sexual contact. So the virus can be passed from one person to another through sexual contact within 24 hours. So it's important to distinguish Mpox from other illnesses like, say, chickenpox or shingles, even other sort of rashes that might be caused by, say, measles. That can also a little bit similar. Bacterial skin infections, even scabies, and in terms of STDs, syphilis, gonorrhea, chlamydia all need to be eliminated to make sure you've got an Mpox diagnosis. And in Africa, at least, although I don't think it's the case in Europe, Australia, or the US, but in Africa, at least, chickenpox is frequently misdiagnosed as Mpox, where both viruses are endemic in the community.
There are some populations that are more vulnerable than others. Can you tell us about that?
Yes, I mentioned earlier that children were very susceptible in Africa, and that's true. The groups most affected, though, are men that have sex with men, people that live with HIV, and healthcare workers that treat people with Mpox, and also travellers that travel to endemic areas. So people who are living with HIV or another immunocompromised underlying condition, as well as anyone with a sexually transmitted disease or an STD, they are at increased risk of getting severe disease, and they're more likely to be hospitalized. Normally, an Mpox infection wouldn't hospitalize you, but for people living with HIV, immunocompromised conditions, it certainly can.
Are we getting the message out about vaccine availability, do you think?
Look, there are vaccines available. The vaccine to use is the one against smallpox. It has about 85% cross immunity protection against Mpox. And there are actually 3 registered vaccines in the world. There's one specific to Japan. There's ACAM 2000, which is actually registered in Australia, US, and Europe. There's another one called Jynneos, Jynneos. It's not registered in Australia, but it is registered elsewhere. Now, these viruses are actually very effective, and it's sort of surprised virologists at least, oh no, we have to use smallpox vaccine again. So I'm glad it's available, and it can be used to protect contacts and protect people in endemic areas. So a vaccine is available, and there is also immunoglobulin available specific to vaccinia virus, which is related to Mpox, and that can also be used if in very severe cases or if there are complications.
Who should be getting vaccinated and speaking to a healthcare provider?
Well, people in the gay community, men having sex with men, they should consider vaccination, and they can speak to their state providers about the vaccine. People who travel and intend to have sex with men, should also get vaccinated. Healthcare workers that are dealing with people with STDs, including Mpox, should probably consider being vaccinated. There are a high number of cases of healthcare workers, particularly in Africa, that are getting Mpox simply because they're treating patients. So they would be the main groups that should get vaccinated.
Dr. Grohmann, thank you for your time today and your patience. Mpox is an interesting disease, and for so many of us, it's still a learning process. Obviously, there's a lot of development still going on in the field around this disease. Anyone intending to be vaccinated should speak to their healthcare provider. Recommendations for vaccination do change from state to state, so make sure you speak to someone. Thank you very much once again. It's been lovely to have you.
Thank you very much for the opportunity.
Thanks for joining us on Matter of Vax. You can get all of the Matter of Vax podcasts on ifa.org.au. Thanks for joining us.